We are here in San Antonio, Texas. I'm here with Maggie Awad, and we have been trying to catch up the last few weeks, but we haven't been able to, so I'm just pumped that we're able to catch up this time.
I'm excited. I'm really excited for this.
Yeah,
Let's go.
We're going to dive deep into some stuff on gut health. But before we do that, I just kind of want to learn like the journey and like how you got to have an interest in gut health and kind of what guided you towards your practice now.
Yeah. So it really started at a young age for me. My mom, she was diagnosed with colon cancer at the age of 32. At the time, I was 15, and it was a very traumatic experience for my family and I, being the oldest of 7, and just did not realize what was going on with my mom. My dad was obviously trying to take her to different doctors and trying to fix it. Unfortunately, it had spread already to her liver, and she didn't make it. And that was just very confusing time for me. And as I got older, I became a nurse, obviously. The thing that happened with my mom, I tend to have a lot of empathy for people and really want to help them get to feel better. And I think because I wasn't able to, quote, save my mom, I took that into my career later as an adult, and I didn't really realize it until I became older. And spent 16 years in healthcare, and I realized, you know what, I want to do something specific. I want to become my own provider, and I don't like the system of how we're just patching up and not really taking the time to listen to our patients and getting to the root cause of what is going on with them. And so I crossed paths with a mentor of mine. His name is Dr. Supaya. And at the time I was, looking at jobs to go into family medicine. And I read about him, and I saw that he did a lot of work with functional medicine, but in the realm of sports and pro sports. So he does a lot with golfers, pro tennis players. And I DM'd him, and I'm like, I want to learn what you do. Because of my mom's illness, I was not given the opportunity to play a sport, and I got to take care of my brothers and sisters at a really young age. So I was the oldest of 7. So I was always been a fan of basketball, right? I've always been a fan of basketball, and I was like, how can I take medicine into pro sport and also take the time to really listen to these athletes and help them with their recovery and help them with their inflammation. And that's what Dr. Supaya taught me. He taught me everything he knew around chronic inflammation, recovery. When you have an injured athlete, you ask yourself these 3 questions, which is why this athlete, why this injury, and why now? Because every single athlete goes through this pretty much the same recovery process. They are eating the same things, and having an individualized and personalized protocol for them in order for them to dial up and optimize their performance. I was like, this is incredible. And it's really unheard of in the NBA, in the NFL. I hear of a couple of doctors that do consult with a few of the teams, but this is pretty much really where healthcare is going, is more diving into the gut health.
You can feel like how committed you are to this. Given the history behind it, like you're just sitting across and you just feel that energy and commitment to wanting to just do better by the next generation. Like that's what I'm hearing and feeling from you. And I think it's impressive that you were as a nurse practitioner, correct? Nurse or nurse practitioner?
Yeah, nurse, and then went back and did my schooling as a nurse practitioner.
Right. So just the initiative to take that and go back just speaks volumes of like your commitment to this. And it's very impressive. I could commend you on that.
Yeah, thank you.
And so from the gut health perspective, like why do you find so much value in that specifically because I imagine you're doing a lot of general medicine as a nurse, but then you've kind of dialed it in to gut health. Like why is that? Where do you find the value in that?
Yeah. So right now you're seeing a lot of research about the gut-brain axis, and now there are things coming about the gut joint axis, the gut tissue axis, the gut kidney, like everything is tied to the gut. And basically, if you were to look at the bacteria, we are actually outnumbered. We are more outnumbered in the bacteria of our gut than we are human cells, which means that the bacteria that's in our gut is constantly talking to our immune system. So whatever that we're ingesting, whatever that we're eating, that's information for our gut cells. And it creates these powerful metabolites called short-chain fatty acids. So I'll go into that a little bit of science. So short-chain fatty acids basically are metabolites that are constantly talking to the bacteria in our immune system, and it tells it what information in order to be able to perform, in order to be able to regulate our metabolism. And you've seen lately that these metabolites are also powerful, that it can actually cause you to have autoimmune diseases and other chronic diseases later on in life, such as diabetes and such as arthritis. So we're seeing a really powerful tie between those things.
I would agree that I've seen a lot of those similar axes that are being talked about, which is fascinating, because I think what I imagine is like whenever someone's sick, like what's the first thing that goes? Appetite, right? And it's like I always just like thought there's got to be something more, like why does appetite always go when someone's ill? And then just you saying that so much of the immune system is a part of the gut. I just think we're getting there, and it's just so exciting to see that, and that you have an interest in that. And you are having success with athletes too, which is phenomenal. So if we take it from an athlete perspective, right? If we talk about, let's just pick like an avatar. We have a 26-year-old NBA player, right? And if we take a 10,000-foot view, right? And we zoom out, kind of what are your big rocks you're looking for relative to the gut health?
So what I'm looking at is what is the testing that I do, what is within their gut that, number one, the absorption of nutrients is key, right? Because you can get the best performance nutritionists, but if there are things going on with their gut, like bacterial process or yeast, or they're dealing with parasites, or they're dealing with anything like that, or they're not able to digest their proteins, that's a problem. And I'm able to analyze those samples and look and see if there's something there that needs to be treated in order, so whenever they are ingesting these foods that they pay other people to pay to, cook for them and all that they're able to absorb those proteins and they're able to digest these nutrients. So it's more of medically looking at is there something that's in the way that's preventing them from absorbing the foods.
Is that would you say that's one of the first steps you look at, is kind of looking at it, like not only is it a nutrient deficiency, right? Because you go through a lab assessment, and let's say, B vitamin's low. Right. So what's the first thing that maybe traditional thought would be? Let's put them on a B vitamin. Let's start eating foods more bioavailable in B vitamins. But what if you can keep funneling, but if they're not absorbing it correctly, maybe that's the real problem. Is that the right thinking?
100%. And I've had labs come back where they are not making even enough digestive enzymes to break down the protein. And so, we talk about protein intake, anywhere from 30 to 40 grams per meal. And if they're not able to break down that protein, then that's a problem. We've got a really big problem.
Right. And that's, so how do you go about doing that? Like, how do you go about assessing, or that's the first step you do, is assessing, like, is even the gut in a place to be able to take in what we're recommending from an optimal performance perspective? Is that your first step?
100%. So one of the things is going to be look at malabsorption, if they do have any bacterial infection going on, if they have a yeast infection going on, and looking to see if there's any imbalance or anything. What functional medicine doctors call it is dysbiosis. Okay. So dysbiosis meaning looking at all the bacteria, because we do have healthy bacteria in our gut, but we want to make sure that there's not an overgrowth of bacteria. So So the whole thing with the probiotic deal and all that kind of thing is we want to make sure that if you're having too much of an overgrowth of bacteria, that can also inhibit the absorption of nutrients.
So is it fair to say you could be having too much kombucha, too much sauerkraut, and too much fermented foods?
I'm not a fan of kombucha. I really am not.
Okay,
I'm not a fan.
Let's dive in there. Why is that?
Yeah, I'm not a fan because I think the number one thing, I mean, there is some alcohol in there, and alcohol also tends to, it causes a lot of intestinal permeability. So I just don't like alcohol, period, if you can avoid that. And the second thing is that, if you want to do some prebiotics, you could do things like green bananas or some green onions or some actual foods instead of ingesting that. So if you don't know whether you have a bacterial overgrowth, that's more safer than having the kombucha.
Gotcha.
Yeah.
Are there other probiotic, like common practices that you're seeing that kind of go against your thought philosophy or kind of go with it as well, just for like general pop?
Yeah, I feel like there's an overabundant intake of probiotics because there are different strands. And so, for example, I had one athlete that was sick and had antibiotics. So, there are different antibiotics for different things. So I want to do more of the Saccharomyces boulardii to help them repair their gut versus the lactobacillus probiotic. So there are different things, different probiotics for different situations. So just taking a probiotic just because isn't the best ideal situation.
I gotcha. Let's dive in a little bit on the antibiotics, because I think years ago, as a medical profession, we found that those are very beneficial with helping eliminating disease and eliminating illness. There's some school of thought now that we may be in a state of overprescribing antibiotics. Do you see any of that in your practice?
I do. I think the two most common medications that I see with a lot of athletes, it's an overprescription of NSAIDs, which is non-steroidal anti-inflammatories, and also antibiotics. And both of those tend to create a lot of leaky gut and intestinal permeability. As a matter of fact, there are studies that are tied back to research when I ask about their history, if they've had antibiotics commonly, and if they've had recurrent ear infections, one of the things that they would have is antibiotics. And the study has shown that antibiotics at an early age has been linked to irritable bowel disease, to Crohn's disease, to leaky gut, to autoimmune disease, because what it does is that at a very young age, those antibiotics can cause that intestinal permeability.
Okay, this is a general curiosity here. I'm curious about this one. The Accutane is a common prescription medication for acne. I believe that's an antibiotic as well.
Yeah, my son was on Accutane. And he was fighting me, and I was like, I had to pick my battle with that one.
Yeah.
I had to pick my battle. So, I don't know too much about Accutane.
Okay.
For me to answer that. I do know that there's a lot of common side effects, and you get to have blood draws and look at your liver enzymes. You got to look at your AST, your ALT levels, and make sure that your enzymes are in check.
Gotcha. Mm-hmm. So we went the 10,000 foot view. We zoomed out. Okay, kind of talked some big rocks. Kind of zoomed in. It sounds like the first step is assessing the gut health. Is it in a place where it can absorb? If we kind of like throw two twists in it, right? Food sensitivities and food allergies. First off, what are the differences between a food sensitivity and a true food allergy?
Mm-hmm. That's a good question, because there's a lot of misconception around it. A food allergy is a true allergy, meaning if you were to eat that certain food, let's just say fish, you are going to have an anaphylactic reaction, and that could literally take you to the emergency room. A sensitivity is something that really happens over time, and that is caused by a leaky gut, intestinal permeability. So what causes intestinal permeability? Those are the antibiotics, Those are the anti-inflammatories. Stress, chronic stress could also induce a leaky gut. And over time, what happens is those junctions in between your intestines, they start to loosen up. And whatever foods that you're eating, so I'm going to give you a kind of a gruesome visualization here, is imagine stool leaking through that, poo-poo leaking through that and going into your bloodstream. Your immune system is going to be screaming at you. So if, say, for example, you ate blueberries and blueberries leaks out of your intestines, your body is going to see that as a foreign object, and it's going to create immune response towards blueberries. So when I do the food sensitivity test, I look at food sensitivities, and if you're having a smoothie before the game that consists of blueberries and you're complaining of joint pain or you're complaining of brain fog, that could be one of the reasons, is because there is a situation where you are having a leaky gut and your body is saying, this food is just, I'm seeing this as something foreign. It should not be in your bloodstream. It should pass through if you have that, if you don't have a leaky gut.
So then is the words food sensitivity and intolerance, are they interchangeable, or in your perspective, they're distinctive? And the context here is, like, I hear people will say, oh, I'm gluten insensitive, or I'm gluten intolerant, or I can tolerate moderate amounts of gluten, or I'm too sensitive to like high amounts of gluten. Mm-hmm. Right? Are those words interchangeable, or are they distinct from your perspective?
Intolerance, I would say intolerance and sensitive, it could be used interchangeably. I've had someone where they weren't gluten sensitive, and now they are. They've developed that, the gluten sensitivity. And so it's just a matter of, number one, getting to the root cause, and what is it that is precipitating the intestinal permeability? What is causing that? Because really what gluten is when you have those two junctions in your intestines called occlutin and zonulin, when those break, that creates that gluten sensitivity. And again, it's just more of the diet. It is more, of course, the processed foods that can create those food sensitivities. Alcohol. I know this doesn't really help athletes, but lack of sleep. I know, we do the best that we can with advising our athletes, blue screens and making sure that they're getting the appropriate foods, before bedtime to increase that serotonin level, in order for them to have more restful sleep. But when you're traveling and stuff like that tends to be hard.
Yeah, 3 cities in 5 days doesn't really help.
Not a big deal, right?
No big deal.
Yeah. And that's the thing, is that it's so hard when you have experts talking about sleep performance and they mean well. There's nothing wrong with that. But I think given the sport, it's really hard. So there are little minor adjustments that you can do, which is making sure that athletes have complete blackout curtains, or, not checking their phone after the game, or if they do, they're wearing blue light blockers, making sure that they're not eating foods that's going to create more cortisol, so that way they can have more melatonin production. So nutrition is a big factor with that. Sugar, not having alcohol afterwards. So there are things that you can do to create when they do sleep, have a more restful, deep sleep.
Gotcha. I agree. But it's still tough. It's still tough.
Yeah.
I would say anyone that's in the pro sports world knows that the schedule does not always favor the optimal sleep schedule, although we all preach diet, exercise, and sleep, but sleep is often the one that gets sacrificed when you have to play games at night.
100%.
Because the interesting thing about being in this space is you really kind of see the shift in effort levels throughout the day. Like, you think like, oh, we have morning practice, we try to get stuff done before practice. but sometimes these guys just aren't awake.
No.
They're not awake at 9:30 when you're trying to get ready for an 11 a.m. practice, because they're at their most alert, most awake, most energized, most caffeinated at 6 p.m. at night, getting ready to hoop at 7 p.m. or getting ready to go on the soccer field for a 7:30 kickoff, right? It's just fascinating to try to do those things, but I always feel like it's an uphill battle trying to get some of the big rocks that we referred to.
Yeah. Yeah. And and then there are actually some things that you can dial in, like things like valerian root and ashwagandha and St. John's wort. And, there's different modalities that I recommend to my athletes, but you're right. It's just so hard. You're at a bright light and you're trying to just relax. And then before you know it, you've got to get on the plane or go to the next city, and it's tough.
Do you recommend those in tea? Like I see a lot of those in now, like you look at the tea section, everything's like stress relief, sleep help, bedtime. And you look at the ingredients like valerian's in there, ashwagandha's in there. Is that your go-to?
Highly recommend.
Okay.
Highly recommend. Yeah, those are really good for the nervous system. Also, calcium. Making sure that you have enough calcium on board. Yeah, those are absolutely phenomenal and will help the nervous system to relax.
You picked on the next micronutrient that I want to dive into was calcium, because I want to tie this kind of all into some context, right? And then some things that I've experienced in my career. I kind of want to talk about two different injuries, if that's cool with you.
Absolutely.
Two different case scenarios, like one kind of like chronic, one kind of like acute standard that a lot of people will see. Kind of like the first one, I want to see if we can tie in some of this gut health, nutrition, some micronutrient is like a bone stress fracture. So bone stress fracture is not a complete fracture, but it comes up chronic over time. It's a load-dependent issue that we often see in athletes that are either overtrained or they're underprepared for the load that's coming for them. So if we just talk on the surface, what are the basic nutrients that you believe are necessary for good bone health?
Number one, it's going to be vitamin D. I think talking about calcium is great. However, you do need that vitamin D in order to absorb the calcium in your gut, actually. So it plays a really big part. And vitamin D plays about 5,000 roles in your body. So if that was the number one, if there was an athlete, they're like, you know what, I just don't want to take these 10 supplements, my number one thing that I would want them to take would be their vitamin D level, because it is so important for your gut. It's so important for hormone regulation. It's important for your bones. It's important for your thyroid, your brain, everything. So vitamin D is a non-negotiable. I've seen vitamin D levels as low as 13 before. 13.
For context, how low? That's very low.
That's super low.
What would you expect? Let's break this into two categories. A high performing athlete. Let me ask you this: does it even matter if you're a high performing athlete versus a general pop when you're talking about vitamin D levels?
For vitamin D for a human being, I would recommend, even for an athlete, anywhere from 50 to 70. Now, that year that we had COVID, everyone's like popping vitamin D pills, the vitamin D and like working out and all that kind of thing. And having high levels of vitamin D in the 90s actually does the opposite. It actually weakens the immune system. So the sweet spot really that I like is 50 to 70.
Now, I've heard vitamin D and vitamin K are like the dynamic duo as far as absorption or just their ability to work well within the human body. What is the relation between vitamin K and vitamin D?
Vitamin K is more of more of the absorption response. And really, I haven't told any of my clients you need the vitamin K, because if they're eating well and they're supplementing with vitamin D, that should be more sufficient.
Gotcha. And then where does the other big rocks that come into mind for bone health for me are magnesium? We talked about calcium, talked about vitamin D. What's the role of magnesium?
Yeah, so the magnesium is really important. When I think of magnesium, I think about the brain. Okay. I think about the brain, I think about the muscles. So it's more in a state of like when you're talking about what I remember this from family medicine is like calcium is more the excitatory nutrient, and then magnesium is more the relaxed nutrient. So magnesium tends to play a lot of other roles in the absorption of other elemental nutrients, and I tend to like magnesium more for the athletes at night. So magnesium, the two that I like are magnesium glycinate and threonate. Magnesium glycinate, if I have an athlete says they're having a lot of cramping, they're just not recovering very well, I would tend to go more towards the glycinate because it tends to relax the muscles more. And the threonate tends to cross the blood-brain barrier. So if they're like, I'm just having a really hard time sleeping and, they're also deficient in magnesium, I tend to go with the threonate.
Gotcha. Okay. I didn't realize there was a differentiation. Excuse me, the differentiation. I'm tongue-tied there. Of crossing the blood-brain barrier and not. Mm-hmm. Okay, excellent. Yeah. So now if we kind of dig a little bit beneath the surface, are there any other things from a bone health relative to either gut or other micronutrients that you've learned about that can kind of add some toppings to the big rocks of vitamin D, calcium, and magnesium?
Yeah, I also love looking at iron levels. Iron is obviously it's really important for your red blood cells, because if you want good bone health, you want good sufficient amount of iron. And I've seen this more in the endurance athletes, where they tend to run low on iron due to, they call it the heel strike. So every time that their foot hits the ground, it actually decreases iron in their body. I didn't know if you knew that. Then I've actually had one player that's happened to, where they've had like an iron deficiency due to like more heel strike on the court. So it's really interesting. So the thing is with iron, it's really tricky. You want to look at iron levels. You want to look at ferritin. So usually you'll see iron levels normal and ferritin levels that are low. And most teams I've seen they look at iron levels. And then I'll go a little bit deeper. I'll look at the TIBC, which is, important to be able to store iron. So TIBC is extremely important. And so I've seen where ferritin levels are low, TIBC is high, and they're needing to supplement with iron.
Gotcha. Mm-hmm. As the first I've heard of the heel strike concept in low iron. Mm-hmm. I'm going to have to dig a little bit deeper to kind of learn more about what that's about.
Yeah, it's pretty cool. You see it a lot more with endurance athletes more than anything else.
Now, do you think that's just the repetitive nature, or maybe not the repetitive nature, but do you think it's like an overtraining syndrome?
Overtraining, and then also dealing with just the oxygenation of just, the pounding of the foot on the ground. It is pretty intrinsic. It's like a long medical background with that, but the pounding more of the foot on the ground, and the nature of the red blood cells. How would you say it? Denaturalizing. They're not bringing in enough oxygen into the blood in order to carry that iron.
Okay. Interesting.
Yeah.
So if we tie it back to a chronic injury of a bone stress fracture, bone stress reaction too, mm-hmm. How would you manipulate those supplementations or those key nutrients to help kind of start the process of recovery early on and throughout the whole process?
Yeah, it's a good question. So someone like that, I would definitely, number one, I want to look at their gut. I know that is my specialty, is to look at that and be like, how can I optimize their immune system in order for the immune system to do what it needs to do? Because inflammation is not a bad thing. It's chronic inflammation. We want acute inflammation. We want the body to do what it's supposed to do, right? We don't want to stop that. It's the recurrent fractures. It's the recurrent sprains. It's the recurrent injury of the body is already under a lot of stress. How can we minimize that stress as much as possible? So looking to see where is there chronic inflammation. if I can minimize that from just looking at food sensitivities, so their body's not yelling and screaming at them when they're having blueberries, like we said earlier, or strawberries, then that's important. Looking at also glucose. If they're having really high level blood sugar levels, that is not an optimal state in order for that ankle to heal. So there are times where I'll put a CGM on there, continuous glucose monitor. You're now seeing that pop up everywhere for longevity. So I'm a really big fan of that. You know, if you have an athlete that is, you know, constantly under a lot of inflammation, I would just monitor their glucose levels and see how they're doing well with their sugars. Another thing I would look at is their blood markers. I mean, the gut health it's new in research. It's really going to blow up in the next 5 years. I really, truly feel like we're going to be looking more at poop than blood. That's just me, which is why I'm so excited about it. But there's more research in blood, and just making sure that their vitamin D levels are exactly where it needs to be, their magnesium levels, all those markers are important. And their hormones, making sure that their testosterone, testosterone, growth hormone, all that plays a really important part in bone synthesis and having healthy osteoclasts, bone cells. And making sure that we're looking at the athlete 360 as a whole, not just, they have this, ankle fracture and we're just going to wrap it up and I don't know what y'all do. That's not my lane, but I'm not saying that's all what you do. There's a high level of respect that I have for physical therapists. And I feel that where this is going is having a team of people. And what I'm seeing is a lot of physical therapists right now are taking the approach and advocating for their athletes and be like, you know what, there's more for them. I want to dig deep and advocate for this athlete and have them get tested. And that way we're all complementing each other. What I'm doing is complementing your work and what you're doing is complementing my work. I really feel like it's a 360 approach. So looking and resolving the chronic inflammation is going to be key to having good bone health.
Excellent.
Yeah.
Then if we flip gears here, we go from like an acute injury, right? So one thing I've seen in more recent years, being in the profession of working in basketball now, is acute ankle sprains. Mm-hmm. And one thing that I've noticed across a couple different players is some people swell and some people don't. Mm-hmm. And I first want to acknowledge that, yes, the severity of the injury matters, and the severity of the injury tends to signify the amount of swelling that will follow. But in certain situations, I've seen the same grade or same severity of an injury, of an ankle sprain, yet one person balloons up and one person doesn't. Right. Mm-hmm. So from your perspective, from a gut health, we're talking about acute edema. And I also want to bring it back to, you said something about we want to allow the natural healing process to occur of inflammation. We'll bring it back there too. But first on the notion of why might some players, some athletes, some people swell more than others from a perspective of gut health?
That's a really good question. So if one athlete is dealing with, say, Klebsiella pneumoniae in their gut, which is a bacteria that's growing, then their gut their immune system is compromised, because we know from research that 80% of your immune system lies in your gut. Mm-hmm. And if the other athlete is not, well, then that means they've got that enough drive and juice in order for them to be able to create an optimal healing environment for that situation. So is it 100% true? No. Is it something to look at? And is it something to dive more? And if you can take the risk, it's kind of like, why not type of situation. So that's really the work that I do. It's again, not 100% based science, but there is enough I would say proof from my work and from what I've seen personally in my health and what I've seen in some people that that obviously we want to optimize their body in a state of healing. And so going back to your question, why does one athlete have more swelling than the other? I don't know that. I don't know the answer to that question. I really don't. But what I can tell you is that having a gut where you're not having to deal with the situation of dysbiosis and where you're not having to deal with bacteria and yeast and parasites. I had this one guy that had a parasite in his gut, and he was like, my HRV, like there's nothing that I can do. There's nothing. Like I'm doing cold baths, I'm, going to sleep. And then I tested him and he had a parasite. I'm like, that's why your energy is going towards trying to heal that parasite that's in your gut. I know that sounds disgusting, but I mean, it's what I've seen in my practice. So I know that was a long-ended answer there for you, Adam, but yeah.
No, it's great because I never would even thought that HRV, I know HRV, I have my Oura ring, mm-hmm. I've played around with it for years, but it didn't even occur to me until this moment to think that wow, that a leaky gut could be influencing HRV, which makes sense, right? HRV, heart rate variability, is a measure of, let's say, recovery and overall readiness. But to consider that what might be your norm may be suboptimal given that there may be an underlying gut health issue like a parasite or like a leaky gut. That is something really more to consider. I did not even think about that.
Yeah. And then I recently, even with brain gut axis, I think that axis is being studied the most because now you're seeing it more tied with depression. You're seeing it more tied with anxiety, and a lot of psychiatrists are diving into the brain gut axis as well, because there's a nerve called the vagus nerve that runs all the way from your gut to the brain, and it's constantly sending messages and signals to one another. The bacteria in your gut is constantly talking to your brain, and your brain is just, it's taking that information. And so things like mood, things like anticipation, drive, excitement, all those have a tie to our neurotransmitters that are necessary, that we need, like dopamine and epinephrine and norepinephrine, serotonin. So you're seeing all of that at full force, and there is a really strong connection in our nervous system when we're talking about the gut and the brain.
Is it fair to say the vagus nerve is the highway between the brain and the gut?
Yes, I would say. Yeah.
So then where does your mind go, right? We talk about not really knowing why those athletes are swelling. Okay, maybe it's a little bit of leaky gut. Maybe it's something going on in the gut. But from, let's say, dietetics and food and maybe supplements, is there anything you would recommend for someone that just sprained their ankle, just sprained their knee, it's swollen, that they can do from an internal environment, right? Because we always think if a joint is swollen, if there's something that I can see, I want to put something on it, right? I might want to ice it, compress it. But from your perspective, with an expert in gut health and dietetics and food, is there anything you would recommend for management of athletes that have swelling or repeat ankle sprains?
Yeah. I think it's easy to say first what not to do, right? And you want to try to eliminate sugars as much as possible, because the sugar is basically, number one, if you are dealing with a lot of bacteria in your gut, that's basically feeding the bad bacteria. The second thing would be alcohol. It's inflammatory. It's an inflammatory thing to have. Now you're seeing a lot of research that even one drink of alcohol is not good for your nervous system. And so I would focus on just eliminating those two. Now the other stuff is kind of easy. Things like turmeric, right, is great. Things that are polyphenols, blueberries, things like pomegranates, things that are more also protein based. You want to make sure that you have enough protein on board in order for you to repair, heal, and recover. But from a gut aspect, I always say things that are more in the polyphenol area, which, like I said, the turmeric, the pomegranates. There's actually right now, speaking of pomegranates, there's a, and I'm not advertising this, but it just blows my mind how things right now are being sold. But there's a probiotic of Akkermansia that's being sold at $100 a bottle. Now, Akkermansia, you can get that from pomegranates. So it just tells you how there's all these anti-inflammatory foods that we can ingest and take in with our bodies and create that same response.
Now, talking about that same response, and when it comes to inflammation, you mentioned earlier that we want to allow inflammation to happen in an acute injury, right? And for decades, we thought inflammation was bad. And that's where the overprescription of NSAIDs came in. And I'm sure you've seen the gut issues that come along with chronic use of NSAIDs. From your perspective, could you just speak upon your perspective on acute inflammation and why it's necessary for healing?
Right. So the acute inflammation, the reason why it's necessary for healing, especially the 48 hours post-injury, you have a lot of cells that are created in order for healing. So those white blood cells need to get into that specific area of injury in order to start the healing process. And there's different stages of the healing process, which I don't remember. That's a medical, that's something, that's not fair, Adam. No, that's something I learned in school. No, but seriously, there's different stages of swelling and healing and all that kind of thing. So we want to make sure that we're not blocking that response and taking things like, SPMs, which I hear some people taking, and it actually blocks that inflammatory response. You don't want to do that. Another thing that I didn't mention was fish oil. It's huge. I am a big fan of a good omega fish oil and making sure that there's a marker that I test for, and I look at the omega-3 index. So making sure that omega-3 index, that number is above 8 is crucial, not just for inflammation, but just for cardiovascular health, overall general well-being, concussion. That's huge for brain health as well. So omegas, I would definitely dial in omegas after an injury.
What would be your recommendation? You say dialed in. Are you saying, hey, let's add fish every day and a supplement? Are you saying, is there a certain number of grams you're shooting for?
Yeah. So without testing you, without just, Adam had an injury and without testing or anything like that, I would just say, at least fish twice a week, and preferably more of a good salmon. And then I would dial in about 2 to 3 grams of omegas every single day. That's without testing you.
And is the split between DHA and EPA matter to you?
That would, for me, because I'm such a stickler, that would be more of like a testing where I would know exactly what to do. And then avoiding vegetable oils, seed oils that can mess up with your omegas. That would be on the do not do list.
Do not do list.
Yeah, the vegetable oils, things that are very inflammatory. And processed foods. But yeah, the omegas are huge, and I've seen a lot of big gains with omegas.
Right on. I've heard you mention a few times about alcohol, and that's one of the questions I had for you, because it's just like, growing up as an American man in this country, alcohol is a part of society, and it's just been a part of the culture I've grown up with. But I've noticed that you have 1 or 2 nights of drinking, and it's like, man, my gut, it just takes a couple of days for your stomach to feel right. It's almost like you feel bloated, but you're not bloated, right? So why, what is the influence that, like you said, even one drink, one glass of wine, what influence does that have on the gut?
So the influence that it has on the gut is when you do drink alcohol, it deals with the intestinal permeability. There's this layer that's in your stomach called mucin, and that also coats your intestines as well. and it starts to degrade that mucin, which is a protective layer in order to prevent that leaky gut. So with alcohol, I mean, obviously, I'm not preaching here for everybody to go 100% sober, okay? Actually, well, I am, no, if you can. But if you do have alcohol, I've also read a study where having matcha helps with deter the effects of alcohol as well within the gut. And so having matcha helps with combat some of the stress that's on the intestines.
So is that a pitch for Starbucks to start spiking their matcha tea lattes?
But their matcha, it's got sugar though. That's the only thing.
Oh, that's a bummer.
I know, but why not? only Starbucks compensate me.
Where does caffeine fit in that? Because I've heard similar perspectives on caffeine, and because I've seen, I constantly am seeing magazine articles, newspaper articles saying this new study about alcohol in the gut, this new study about caffeine and coffee. Like, where does caffeine fit in the picture of gut health?
Yeah, so coffee. So caffeine is, we can either talk about coffee or we can talk about tea, right? So if we're talking about caffeine, I have seen studies where caffeine has exerted a lot of antioxidant benefits to the gut, right? And it's anti-inflammatory. It has that proliferatory effect on the lining of the gut as well. So it proliferates. It makes good bacteria, believe it or not, which you want more soldiers. You want more good bacteria in your gut. So green tea is always good, right? It's caffeine. It's got a lot of great benefits. It's a polyphenol. It's an anti-inflammatory. The only thing that I have with caffeine is making sure that, especially coffee, is making sure that you have that. Wait about an hour to an hour and a half after you wake up, because we don't want to mess with your cortisol spike, the natural cortisol response that we have, because cortisol is also an anti-inflammatory. So we want to make sure that right when you wake up from the bed, that you're not taking in that coffee and not inhibiting your body from naturally spiking cortisol. And so waiting about an hour and a half afterwards and having your coffee would be ideal. So
you're saying caffeine, so when we wake up, we have this natural spike in cortisol. Is that what I'm understanding correctly?
After 30 minutes.
Okay. So then are you saying if we have caffeine, so most people, right, the first thing they do when they get out of bed, if they're not going to the gym, is they may be making a morning cup of coffee, morning cup of tea. You're saying to us not do that for the first hour because that inhibits that cortisol spike?
It inhibits a natural response of cortisol spike. So basically what we're doing is we are taking something exogenous outside of our body and drinking it and not allowing the body's hormonal process in order to have that natural spike.
So would you be altering the natural process? So say, for example, you remove that coffee, right, from the first hour. What would you anticipate would be the natural response after that if they've been doing it for so long?
So if they've been doing it for so long, that is a good question. If they're doing it for so long, I would suspect that if you do take away that, obviously the coffee, it doesn't last in your system for that long. I don't know what the half-life exactly of what particular coffee that you have, but you do see that natural response of cortisol happen 30 minutes afterwards. And you do want that to happen. Because you want to balance out cortisol and melatonin appropriately. And that way we're also optimizing our sleep, because really with sleep, it starts the day before, and the cortisol awakening response is whenever you have an athlete that's inflamed, right? You don't want that cortisol to stay in their tissues. So you want to be able to make sure that they're metabolizing that cortisol. And the only way to really do that is to just make sure that within the hour and a half that they're waking up, that their body's having that natural process instead of having something outside of them.
Okay, that makes sense. Mm-hmm. Now, what I appreciate about what you do is you're very dialed in on the testing. And one of the testing that I've gone through a couple different companies doing, but it's stool testing, right? You said we're going to start measuring poop more than we are measuring blood. All right. So I'm just like curious your perspective on first, let's just talk about, I think some people are a little scared to do a stool test. So can we just talk about what some companies process, because everyone has a different way of stool collection sampling.
Yeah.
What would you say the process is? And if you have a recommendation of a particular brand or style of doing it, I should say.
Yeah. So I would say that, I know for me, I rather do sample than being poked with a needle. That's just me. And the process, I know with me, since really, I mean, with my clients, I pretty much do all the testing, is you just got to do it. I mean, there's just no way to do it. I mean, it's just like, you just provide the sample, and then I have vials where I'm putting each of the sample in the vials, and then I send them away, and I come back with a report after 2-3 hours. If it's a kit that they get to do on their own, it's self-explanatory. It's not rocket science. I think the thing is where I get the most questions about is analyzing the data, because now you're seeing all these, there's so many companies right now, like even Thorne right now is doing stool testing, and you have, Viome, and you have Genova, and you have, you have all these companies, and it's not the test itself. It's like blood work, right? It's not the test itself. It's who is going to read that test and come up with a plan for you based on your history, based on your physical, based on other things. So it's kind of like, you can, it's like buying a steak, right? This is like, I've used this analogy before. It's like buying a steak, right, from the grocery store. Like, do you want to have, I don't know, do you want me to cook it, or do you want Anthony Bourdain to cook it? And you want Anthony Bourdain to cook your steak. You know what I mean? Like, he's the master, right? So it's really just finding someone who, once you have these results, finding someone who you trust that can be able to create a protocol for you and feel comfortable with it, and be able to, and not just that, but just seeing actual results.
It's very important to make sure you have the right practitioner reading it, because we are inundated with information and inundated with testing. I had no idea Thorne was getting into that business now too.
It's crazy, yeah.
And so it's very important, like you said, to make sure you have someone that can put the pieces of the puzzle together, right? Because that's probably the hardest part nowadays. It's just like we get all this information, but who's synthesizing it for you to put together a cohesive plan? That's probably the biggest challenge.
Right.
So within everything we talked about, there's like from gut biosis to stool sampling to caffeine to alcohol, right? The thing that I love talking about this stuff is it gives me other avenues for having conversations with athletes, because when you're going through rehab, you take away their identity by you taking away their sport, right? They can't do the thing that they love most. So how are we having that positive conversation with them to help them keep finding their small wins throughout the process? So I would imagine, in my experience too, right, with dietetics and blood work, that stuff takes time to change. And it really takes time for gut health to make some positive changes. So like, what is the conversation you're having with your clients to help them find their wins when they're going through this process, to keep them motivated to stay through the whole journey?
Yeah, that's a good question. I think that question, like for me, I just think about anything in my life, right? And things that I've told people in the past. It's like, think of the end goal, right? That's why that vision is so important. Like, because once you have that vision, there's going to be times where you become very doubtful. There's going to be times where we're going to have breakdowns. I mean, we're human beings, right? We're going to have a lot of breakdowns. It's inevitable. It's going to happen. So really staying focused and reminding them of that end goal, like when I have a bad day, right? Or when I'm going through breakdowns, I have people in my circle that remind me of my vision. You know, they remind me of the end goal. They remind me of my why, what my intention is. So reminding them of like, hey, do you remember when we started? Like what your intention was? Do you remember what your vision is, what that looks like, what you want to become? And I think just really hanging on to that is going to be really important.
It's being committed to the long-term goal and having the patience too, right? Having the vision, like you said, to be able to get through the end. Because if you don't have it, you don't know what you're working towards.
Yeah.
How would you define a small win for someone? Like if someone says, hey, like I'm having a tough time trying to find success, like how would you reframe that or shape that for them?
I think for me, it would be, okay, what has worked? Because when we're in that mindset, it's typically a mindset we're thinking where things are not working. But it's like, okay, how the past, say, for example, the past 30 days, what has shifted? Even if it's something completely small, it's like, oh, well, do you remember when you lacked a little bit of energy? And what would you rate your energy from? Like, is it 20% better? Is it 30% better? Is it 50% better? Is it 80% better? And hey, if it's 1% better, I'll take it. That means we're moving towards progress, right? So if it's the 1%, I'll take it. And it's just a matter of really being consistent when results are coming slowly, because we live in a world of just fast food everything. Fast food results, fast food testing, fast food rehab, fast food, all that. And so instant gratification, and I know with like the clientele that we're working with, obviously they wouldn't be where they're at if they had that mindset of having instant gratification. I'm just saying there are times where we are human, where we forget that, and to be surrounded by people that remind us of the transformation and the things that have come about along the way, the good things that have happened is important.
Yes, very important. All right, we're going to wrap things up here soon. And we're going to go through a little bit of like, kind of like some clickbait, tips, tricks, right? Things like, I'm going to disclaimer here. Maggie is way more sophisticated and way more detailed with her work. So like these things I know are going to hurt her soul, but like we're going to ask them anyways, right?
I'm scared. No, I'm just joking.
Ready? We're going to pick one thing. Okay. What's one thing someone could do today to evaluate their gut health?
The one thing they can do to evaluate their gut health. Are you having one every day? Are you having, are you pooping every day?
That's a great one. That's so, it's like it's amazing. If you ask that question, people are like, oh, I go every 3 days. And I'm sorry, 3 days?
Yeah. I don't like that.
Yeah.
That means you've got 3 days worth of food in you. If you think about it.
Oh, people are like, I put on 5 pounds. Have you gone to the bathroom yet? No. Okay. Yeah. Fair enough. Okay. I like that.
Yeah. It doesn't require a test.
No.
And someone that has a good, I would say two bowel movements a day, I would say gut health is pretty much on point.
Okay. Now the people that are listening and saying, man, I haven't gone to the bathroom in 4 days. What would be the next step for them?
I would say the next step for them would be asking themselves, are they dehydrated? Right? Our intestines absorb a lot of water. So are you drinking enough water? Are you dialing in enough fiber? 20 to 30 grams a day. You know, we are over proteined and under fibered. I would say the average American probably has 5 grams of fiber a day. And if you were to study some other people around the world that have less chances of colon cancer and gastric cancers, they are dialing in a lot more fiber. So water and fiber, I would say the 2 things.
Perfect.
Yeah.
What are the top 3 things you feel give the biggest bang for your buck when it comes to nutrition?
Okay, so I'm going to go with, obviously, go to the grocery store, prebiotic foods. So prebiotic foods, garlic, onions, green apples, asparagus. So those are prebiotic foods. Whenever you eat those, that actually create probiotics. So whenever you ingest prebiotic and your digestive tract creates postbiotic foods. And also some things out there would be, I'm a big yogurt person. My kids hate yogurt. They they're not big yogurt people, but definitely yogurt, some kefir, kimchi, sauerkraut, dialing those in are going to be good.
Perfect. How about the 3 worst things that you see clients derail their plans with?
Yeah. So the 3 worst things, I think we talked about sugars. I would say also a lot of fruit juices. Juices that are like apple juice or things that are like 40 grams in one thing. So you want to avoid a lot of hidden sugars. Again, the alcohol, not getting enough sleep would be one. And stress. Managing stress, because stress plays a really, really big part in our gut health.
You mentioned fruit juice. What's your take on juice cleanses? As she rolls her eyes.
I have never done a juice cleanse.
Okay.
I've never done a juice cleanse, and I don't know enough research or have read enough research to give you a good answer. I'm all about that. I'm all about having enough research in order for me to tell you the right thing.
I appreciate that.
Yeah.
How about this? The number 1 modern day myth that you have to routinely debunk.
The modern day myth. I would say that that really gut health has to do with a lot more than food. Gut health is more of a lifestyle. And I could tell you that, with gut health, it's not something that you're going to find in a pill. It could be something a lot more than that. It could be more in relationships. It could be more in setting boundaries. It could be more in being happy, having joy, true joy in your life. And that really starts at a really young age. But I'd feel like that would be the number 1 thing, is try not to solve problems in a pill versus more look at something more exterior. Look at, your physical health, your mental health, your spiritual health. I know we didn't really touch on that, but I'm a big proponent of that. Just talking to my clients and be like, what is there something outside of your sport, something bigger than you that you can focus on as well? That's important.
It's very important.
Mm-hmm.
You're a parent. I'm a soon-to-be parent.
Congratulations.
Oh, thank you very much.
Well, you just threw that at the end of the podcast, Adam.
That's actually that's my favorite thing to do with my wife right now. Is we've been holding out, casually telling people, and
congratulations.
And thank you. And so my favorite thing is just casually throw it in there as a comment and just see the person's response. Rather than hey, we're expecting, other than no.
Oh my gosh.
It's here we are. But anyways, long side story. One thing parents can do for kids relative to gut health.
Parents can do for kids. Yeah. The whole fruit juice thing, don't buy fruit juice. Don't do that. So it's just a lot of sugars, and, try to get fun with food. I think is also great. What I do with my son, cause he's not really a veggie person, is I making smoothies, and I'll sneak in some spinach in there, and then I'll make him some chocolate muffins, but all of a sudden they're kind of green. So I'll throw some, greens in there, or I'll throw some collagen, or some flax seeds, those types of things. And he doesn't even tell the difference. So, and have fun. I feel like also kids are nowadays, I just remember just going home and doing my homework and play. And now you're seeing kids They've got homework, play. They've got 5 days of practice. They're in band. They're in choir. They've got, they've got a tutoring because they've got to get ready for the SATs. It's like there's a lot of demand on kids. So stress management and making sure that they're also being loved and cared for and is huge.
Perfect. Make food fun again. I like that.
Yeah, and make food fun again, for sure.
Well, this was awesome. I've learned a bunch from you today. I actually answered a lot of my questions, which was fantastic. Like, definitely have some things to chew on, though, and go learn some more research and get you some more info.
Yeah.
But like for our listeners, where can they find more information about you and your work?
Yeah, so I'm pretty active on Instagram at Maggie.Awad, AWAD_. Someone took my name, so I had to put that underscore in there. Also, elevate2perform.net is the website. And I'm also on LinkedIn as well. I got on the LinkedIn bandwagon. Oh, and I just started Twitter. So we'll see how that goes. Someone wanted me to do TikTok. I'm like, no, I don't know if that's going to happen.
Hey, that's a whole other medium I'm still exploring too. So I can appreciate the fear avoidance of that as well. It's a new platform for me too.
Yeah.
I get that.
Yeah.
Well, perfect. We'll make sure we put all that in the show notes for everyone. And thanks again for coming down.
Thank you so much, Adam.